Hello and welcome to the Power of Inclusivity. My name is Samuel Matsikure and I'll be your host. This show will be focusing on promoting, advocating, educating and challenging policies as well as social norms for LGBTI persons' inclusion in the democratic process in Zimbabwe. The Zimbabwe socio-political context is largely characterized by stigma, discrimination and marginalization of LGBTI community. This amplifies the dehumanization and exclusion of LGBTI persons in exercising their democratic rights, provision, and access to human rights services. This show is brought to you by Bayete Development Institute with the support of the Canadian Embassy in Zimbabwe. My guest today is Ruth Ndlovu from Butterfly, and we will be talking about intersex persons in Zimbabwe. Ruth, welcome to the show.
Thank you.
And what can you tell me about yourself and your organization?
My name is Ruth Ndlovu. I'm from Bulawayo. Butterfly Care is a PVO, objectively looking at people born with ambiguous genitalia. When we're talking about ambiguous genitalia, we're looking at the disability of the genitals. So Butterfly Care is there to make awareness to the people, to the community, to Zimbabweans, and to streamline those people who are stigmatized back to the society. We want the world to know, we want those people to have their full life in peace and in loving atmosphere, to be accepted.
And what are intersex? What does it really mean?
Okay, well, I've already said that intersex, we're looking at children born with ambiguous genitalia. Right, sometimes it has to do with chromosomes, it has to do with genitals, it has to do with gonads. When chromosomes act up in a way that is not expected, and that disability centers around the genitals, whereby, for example, you'll find a girl child born with an enlarged clitoris. Instead, when a child is born like that and is presented right in at hospital, automatically the nurses or the midwife will say there is something wrong with their genitals, but because they are not sure what it is, they sometimes, because of that enlarged clitoris, they might say the child is a boy, thinking that enlarged clitoris is a penis. Sometimes a child is born with, instead of the labia can fuse and becomes more like scrotum, although when they feel it, they are not testes inside. So all these are different types or different scenarios, different pictures of ambiguous genitalia. Sometimes a child is born with a micropenis. That means definitely there is a problem which centers around the hormones and all those androgens in the system.
This must be difficult for parents who have such children in a society where you expect that you have to have a child who's either a boy and with clear gender and clear genitalia, especially in our society. What are the biggest and most common misconceptions about intersex persons?
Yeah, it is very difficult for a mother. You carry your child for 9 months. You start preparing, moms can sometimes prepare for pink, blue, anticipating, but voila, you come up with someone who you don't even know where to place. The misconception about ambiguous genitalia or about intersex is that people think that these kids or these people have both genitals. And the other misconception is they always think, that one, since he has two, they can also have sex by themselves. See? They don't need a partner, which is a misconception.
And what is the current policy when it relates to surgery for intersex children?
Well, none that I know of at the moment, but what I know and what we have realized is we come up with children as old as people as old as 42 living with ambiguous genitalia, meaning they were born in our local hospitals, they were born in our local backyards, but nothing has been done. No surgery has been done. No one has talked about it. No one has said anything. So, meaning there is something amiss there that is not, or that has not been addressed.
In your work, have you met young people, older people who have also gone through surgery, and what are their stories like?
Right. As I said, I'm from Bulawayo. We started the awareness about intersex some years back. The response has been slow, but eventually we are breaking the barriers. 2019, we had one child who had a corrective surgery. She was from somewhere around here in Zimbabwe. She's a girl, and she's a beautiful young woman who didn't know where or what was wrong with her. I remember when I asked her, "What's your greatest wish?" She said she just wants to bath with other girls. She was raised as a girl. So the surgery was done at Bilo Hospital by Professor Solwayo Ngwenya, who is running the clinic currently. Yes, I've seen them, we have them. Bilo has got a register that is ongoing. Right now we have patients from all over dotted around Zimbabwe who are coming to seek help, as old as 42-year-olds.
And what can we do to build an atmosphere of inclusion, regardless of religion, culture, or personal views, especially around intersex persons?
Lack of knowledge is very dangerous. As long as people are not aware or they are not given that information, we tend to believe that these things do not exist. We need to talk about it. Like we're talking about it now, we need to get the information on hand. We need to advocate more. Do virtual meetings, pamphlets, trainings, talk to the government, train the midwives so that everyone is on the same page. So we need to make so many awarenesses.
We need more awareness and more education, because sometimes ignorance then makes it hard for intersex persons to speak out, especially in a culture where there's a lot of silence around sex, sexuality, and sometimes the issues that people face in society. Join us in continuing the conversation after the break. Welcome back. As we were talking about intersex persons and the issues that they face, are there any risks associated with being intersex?
Yes, there are so many risks. If we go back to the drawing board, looking at the outer or the makeup of the genital, it has different outlets for urine, it has different outlet for this. But then, because in certain cases where the labia fused, meaning it also closed up that urinal hole or tract there. So you'll find that whatever the outlet the child or the person have, is not big enough to let out urine. So there is a problem with the urine outflow, meaning as we all know that our urine, it's flush coming from the kidneys. So as long as there is no total output, the kidneys in the long run are going to be affected. We'll find cases whereby people just from nowhere, they have kidney failures. That's one challenge. The other one, being intersex does not mean female hormones are no longer at work. They are still working. When the time comes for one to have their menstruation, still because of the little or tiny outlet, there is a lot of blood that is going to be retained within the stomach. What will happen to that blood? You'll find again people having stomach cancers. And the other thing, there is a lot of shame, there is a lot of embarrassment. No one wants to live with the unknown. So those are the health challenges that an intersex person faces on a daily basis.
And do you think the health providers in Zimbabwe are well trained to deal with intersex needs?
I won't say they are well trained, because what is happening or what happened 42 years or 15 years ago when a child was delivered in the hospital and he was given to the mother, because there are no systems in place, the healthcare are not really equipped. Sometimes they are stuck as well, just like everyone else. So they are not well equipped, they are not trained, and we can't blame them.
So there's a lot of work that needs to be done to have healthcare workers specialize, especially in issues that are related to intersex persons in our training institutions. And how can we have more in-depth, especially around research that is needed to adequately address discrimination and other violations of intersex persons, especially relating to their human rights?
If everything needs funding, if the government, if somebody out there can throw in the funds, do a thorough research, do a door-to-door, find out how many kids are suffering, what is the cause, what's the best way to go forward, I think this mountain can be destroyed somehow.
Are you aware of any statistics that perhaps could tell us how many, or possibly an estimate of intersex persons in Zimbabwe?
Well, since no one is talking about it, we are just getting bits and pieces, bits and drops of information coming in, meaning the little information that we have, maybe it's about 2%, according to the specialists that I've mingled with, like the likes of Professor Solwayo Ngwenya, Bulawayo Mpilo Hospital. As long as we are not talking about it, as long as it's still a taboo in our culture, as long as we shun these people, as long as we're trying to ignore, we're not going to definitely get the right statistics. We will keep guessing, and people will keep saying it's non-existent.
And what are some of the human rights violations that you have noted that intersex persons experience on a daily basis?
Well, I feel sometimes other kids, they do not have birth certificates. Some kids are dumped by their parents, or the father will just dump the mother. They will divorce, or the mother will dump the kids to the grannies. And those kids, they can't access the birth certificates because the grannies are not allowed to acquire for them. What the system wants is, when you go to the registry, you need to be a parent. So they end up not going to school because they do not have a birth certificate. The government does not recognize anyone without a birth certificate. So it becomes a challenge. What if the government would say, okay, if a child is born with ambiguous genitalia, within the 6 weeks, do not give him gender, or don't give them gender. Don't assign. Don't assume this is a girl. Don't assume this is a what? A boy. But instead, allow the medical system to go through the processes, find out, do the scans, do the blood test, do all those things to really, really find out what are we really dealing with, rather than assuming because you see an enlarged part there, you see a fused part there. But if the government will allow such cases, a child is born with this kind of disability, let's just wait and find out what the medical system says before that. That will give everyone the opportunity and these children to go to school. At least they will have a certain document that says, this is a child, this is a Zimbabwean. He has the right, or she has the right to go to school. But for now, we are holding to the gender.
So for young people, issues around right to education, right to citizenship, identity, and so on is a problem. What about for adults?
Yes. Like when we are looking at a child born with ambiguous genitalia, they tend to be more muscular. Why? Because there is a lot of estrogen being pumped into the system due to the 21 hydrolex enzyme, which is missing along the chromosomes. So it becomes they are more prone to be more masculine, even if they are ladies. Now, people always say, hey, that one, it's a tomboy. So no one wants to associate with them. Even the family, they are not sure. They can call them anything. In Sindebele city, Yincukubili. Not necessarily that they have got a very big male genital, or a very big, that's what we think, they've a big male genital, big female genital, you see. So such things, they are there. They just need to be addressed.
Well, we've got so much to talk about and learn from you. Join us in continuing the conversation after the break. Welcome back. We've got more to talk about intersex persons, their struggles, their rights, and also have a better understanding. What are the key demands from intersex persons advocates, especially in relation to the public, policymakers, and parliament?
As an advocate for the people born with intersex, I feel the government has to do better when it comes to issuing of birth certificates that I've mentioned, when it comes to inclusion for them in policy making decisions, because you know their needs unless they tell you their needs. So it goes back to the government doing or stepping up the game, because everything starts from a birth certificate. As long as you don't have a birth certificate, you can't have an ID. As long as you don't have a birth certificate and an ID, you can't apply for a passport. So all these registrars, they should be aware that this is happening within us. We are not immune as Zimbabweans not to have people of intersex.
And we are aware there's a lot of labeling that comes with society, especially for intersex persons. Some might even call them gay, stabani, ngochani, tomboy, as you said. There are all these namings. How can we raise more awareness to improve their lives in Zimbabwe?
We still need funding. We need more funding, especially in educating people. It's so painful just to be labeled something that you are not, because people lack knowledge. Without proper knowledge, without proper education, we are going to keep destroying ourselves. So funding, that's number one. As long as we have money, we are going to go door to door preaching about this. We'll go to the churches, we'll go to the community, we'll go to the clinic, we'll go to the schools. You know, there's so much hate speech even coming from our little ones. That information, when it is descended to them at their own levels, children are easily adaptable. They can easily change, they can easily embrace.
And what role do you think the traditional leaders or religious leaders can play in society to raise this awareness?
I think just basically about, just like everyone else, whereby they sit down with the chiefs, sit down with their subordinates. We talk about such things, because in our rural areas, you'll find, for example, I have one case in Guy. The child was born with ambiguous genitalia, and the father thought, okay, this child is a girl. They could see the outlet there, but they could see that enlarged clitoris. What the grandfather did was they had to take a twine, trying to tie that thing, hoping it's going to what? To fall off eventually. But it didn't. It did not fall off, and eventually they had to live with it, but in shame. Even if you go to the chiefs, they are not aware. So we need to start from our own medical health care, because those are the people who welcome these little children into the world. They are the eyes.
And how can we involve intersex people in development of measures to address their own needs?
Let the country vote them into the parliament, into the high seats. Let them be respected, because when we're looking at ambiguous genitalia, it's a disability that is hidden, but you can tell by the features. Sometimes you can say, oh, okay, I think this one is gay. You can name them. You can name them whatever you want. But did you try and understand what is going on? What is their disability? Let them be heard. The people with ambiguous genitalia, let them be heard. Let them have the proper representative from their own society. Let them be heard.
So inclusion for you really means they need to be heard, they need to be listened to, they need to be involved.
Yes.
Oh, that's quite interesting. And how can we facilitate intersex persons to access justice or investigate or acknowledge, especially post-human rights issues, or when they experience human rights issues?
I think it goes back again to awareness. Yeah, if the community is aware of what is happening around us, I'm sure everyone who's an intersex, they will slowly come out. If they are confident with the systems that has been put in place, if they are happy and they feel they are welcome, if they know they're not going to be a laughing stock, if they're not going to be discriminated, if they're not going to be abused physically and otherwise emotionally, they will slowly come out and they will get help. Some of them can get corrective surgeries, some of them can get counseling, some of them can just get a hug. Not everyone is going to have corrective surgery. Yeah, in the cases like you have someone with a micro penis, whereby it's as big as maybe a half thumb, that person culturally, because he's a boy and he has that organ, he's expected to marry. And he's expected to marry whilst his organ cannot function properly. So it becomes a challenge. We need to let everyone involved. The parents have to know, the grannies have to know, the chiefs have to know, the sopukus have to know. Everyone has to know. The teachers have to know. The caretakers have to know. We take our children to the nursery. They don't know how to handle them. So if everyone is included in dissemination of information, let the information be publicly available.
You said something that I found interesting about relationships. You know, that they also want to have a family. Everyone has the right to have a family. Yes. Is it easy when you're intersex to have relationships and be able to find a family in this country?
It's not going to be as easy as anyone else, because when we marry, we are looking at that genital part. And if we find it otherwise, it becomes a problem.
Inclusion, and I think that's important, because that's the only way we can know what intersex person needs are and also what rights needs to be protected. Thank you very much for joining us for today's episode, where we're discussing the needs and issues of intersex and inclusion. This show was brought to you by Bayete Development Institute with the support of Canadian Embassy in Zimbabwe. Join us for the next episode.